Mentioned earlier, Maxicare. Hello, Maxicare. Maxicare is one of the pioneers in the health maintenance organization industry. With more than 3 decades in the industry, they have provided comprehensive healthcare programs through an extensive network of medical providers and enhanced customer support. To talk about the company's various sustainable initiatives, we'll be joined by the Chief Strategy Officer of Maxicare Healthcare Corporation. He helps drive initiatives that prioritize affordability, preventive care, and efficiency across Maxicare services. And in 2024, he was recognized as one of Asia's top 10 Chief Strategy Officers by TradeFlock. So ladies and gentlemen, let's all give a round of applause and welcome for our fireside chat, Mr. Kurleigh Gacutan. I think one more. Here you go, sir. You can take my microphone first. Here, yes, please have a seat. We'll go ahead. Okay, so I'll sit over here so that I don't block the screen. So first of all, thank you very much for joining us today. We have a lot of students here, as you heard earlier, with very significant courses that we'll learn from our fireside chat today. So before we begin, do you have any short message for our students in the audience?
Thank you for inviting me in this successful event, especially for Manila Bulletin. For the students, I'm actually looking forward to be working to all of you in the coming days, because we have a lot of school partnerships that we are working on right now, as well as we're looking forward for an exciting event for different universities that we will be launching late this year until next year.
Perfect. Thank you very much, Kurleigh. So let's get started with our fireside chat, okay?
Just please be gentle with me, okay?
I'm sure. Honestly, this will be fine, but our students later might give you a bit of a challenge.
Okay.
So let's begin. So Maxicare has been actively expanding its network of primary care clinics, or PCCS. Kurleigh, can you walk us through how you're identifying the best areas for expansion, and also why accessibility is such a key part for your healthcare strategy? Juana mentioned earlier about accessibility to good products. So in terms of healthcare, can you expound on that, please?
Actually, when we map out our areas for our primary care clinics or our PCCs, we don't just look at pins on a map, but rather we try to look at the life around that area. So it also allows us to ask ourselves questions like, looking at this space, is there a mom right here who cannot afford long trips to the hospitals? Or in this area, is there a lolo who requires regular checkups but finds hospitals overwhelming? For us, when we look at our future sites for PCC builds, we don't just use factors such as the population density or the real estate prices. We try to walk into the shoes of our customers as well, who work and live around that area. Because for us at Maxicare, accessibility is one of our love languages. And when we talk about accessibility, we mean that we try to situate our clinics into areas that we believe we can truly make a difference. These are areas such as locations near office hubs or transport clusters. And we believe these areas will help us promote and touch base closer to our customers. So we believe that, I need to use that point, in order for us to be accessible, we need to be near enough to help as well as fast enough to matter. As of the moment, we already have 35 primary care clinics, but most of it is concentrated into NCR and Metro Manila. But at the end of this year, our goal is to add 20 more clinics that's spread all over the country. And even if our intention is to have a total of 100 primary care clinics all over the Philippines by 2028, at the rate that we're going right now, we believe that we can be able to reach that earlier and reach more Filipinos.
Okay, perfect. Good plan then. Thank you for sharing that. Now, now can you tell us, how does the presence of Maxicare PCC, you mentioned earlier, in the underserved areas, how can that part improve patient outcomes and also reduce the reliance on hospital-based care?
First of all, we love hospitals. They are always dependable partners. We are friends with hospitals now. But to answer your question, allow me to use an analogy. At Maxicare, we believe that we play a pivotal role in this healthcare ecosystem now. We are healthcare navigators. And as healthcare navigators, we give you the umbrella before the typhoon hits, not after when you're already soaked. In looking at the map of where we will be putting our primary care clinic, we try to situate ourselves into locations where we can be able to catch illnesses earlier. Because by doing so, we can manage conditions faster and we can help prevent minor illnesses from becoming major emergencies in the future.
Or perhaps like overcrowding
Yes,
in
the hospital. So the effect of this is better patient outcomes. On the side of hospitals, they will be less stressed and less burdened. And of course, to support sustainability, we will be promoting healthier and more stronger communities, in effect.
Okay, I'm glad you said that, healthier and stronger community, because, Kurleigh, you know how we always say that prevention is better than the cure, right? Especially when we talk about things like cancer. Prevention is always better than the cure. However, in the Philippines, preventive healthcare always or still most often takes a back seat. How can Maxicare, or how is Maxicare shifting this mindset of prevention is better than the cure?
Well, thank you for that wonderful question. When we talk about preventive healthcare, it actually feels optional for most Filipinos, especially when budgets are tight.
And if they don't feel anything, they're not going to do anything.
So for us, in order to support that preventive healthcare space, we try to make access a lot easier by means of incorporating preventive services such as annual physical exams as well as wellness programs as part of our product design and construct. Because to add to that, we are also actively engaging our customers, educating them through workshops. We do also active participation and school partnerships in events like this. We're also doing a lot of company wellness days, as well as even online consultations. We try to embed health check-ins as part of everyday life, not just a luxury, quote unquote, when something feels wrong. Because at the end of the day, we try to position this preventive healthcare mindset as something which is not scaring people, but we try to put it into a space that is normal, affordable, as well as empowering.
Not intimidating.
Yes.
Or because it doesn't have to be scary. Checkups don't have to be scary.
Yes.
Maintenance doesn't have to be scary.
Before joining Maxicare, I haven't had any annual checkups, but right now I'm required to do frequent visits to hospitals.
I suppose it's like saying, diba, if you have a car, you're not going to fill up the gas when it's empty.
Yes.
Diba? You want to fill up the gas while there is still fuel that can take you to the next destination. Otherwise, masisiraan ka.
Yes,
right?
that's correct.
Kurleigh. Now, in addition to that, because we're talking about preventative healthcare and modernizing everything, technology. We are in the age of technology now. It's part of our lives. We can't avoid it. It's really, the normal state of things now. Technology is playing a bigger role in healthcare than ever before, right? Can you tell us how Maxicare is fortifying its digital platforms to better serve members and stakeholders?
Actually, when we talk about technology, we're doubling down our investments in terms of our systems and platforms, in order for us to complement our footprint in terms of our primary care clinics. Because we believe that healthcare should be where you are when you need it. That's the reason why we are heavily improving our mobile applications. We're also upgrading our teleconsult platforms. We are also doing ways and finding opportunities on how we can create faster, as well as more intuitive with the help of AI, more intuitive member portals. Because what we want our members to feel is that healthcare is as natural as booking a ride or ordering your favorite food.
Or GCash.
Yes.
Yeah, very easy. Yeah. So just at the tip of your fingers,
yes.
The click of a fingertip. And you can, if you're able to do that remotely or, on the go, you can even save time.
Yes.
We don't have to worry about traffic. So it's not an added stress.
Yes.
if you have these
It's not
applications.
an additional burden to you. Yep.
Exactly. Thank you. Now, how do your digital tools support the continuity of care and make health more sustainable? So you have technology. How can that make healthcare more sustainable in the long
Just
run?
between all of us right here, we're actually investing in a multi-million-dollar, top-of-the-line healthcare insurance system. And that will enable us to integrate our multiple standalone platforms into one. Our intention into investing into this one is that for us to be able to significantly minimize, if not totally eliminate, the friction across our member journey. We're actually, it's part of our 5 strategic thrusts, our investments on data as well as technology, because we believe this will become a critical anchor for us, because we think that digital tools help us connect the dots better. Yep.
Perfect. So now let's look into the future, Kurleigh. In the bigger picture, what is Maxicare's vision for the future of healthcare in the country?
To answer your question, allow me to do a quick plugging lang of what we do at Corporate Strategy. I'm part of Corporate Strategy, and we spend most of our time into thinking about the why behind the things that we do. And I've been with Maxicare for more than a year now, and I want to share to you guys that our why is simple, but it's very powerful. We exist, Maxicare exists because we want healthcare to become more affordable, more human, and more responsive to the needs of every Filipino family.
Perfect. And how does since we're talking about sustainability today, how does Maxicare define sustainability? And what role do you see Maxicare playing in shaping a healthier and more equitable system?
For the healthcare ecosystem, when we speak about sustainability, we actually support SDG number 3 and number 11, right? It's more of nurture rather than nature. For us, the concept of sustainability means being the market leader currently. It means that we need to be at the forefront in terms of building a healthcare ecosystem that people can rely on, not just today, but also for the coming years. We're very much vested into prioritizing, in making sure that preventive healthcare is prioritized, that our investment in terms of data, systems, platform, and technology make access faster as well as cheaper. That's the term, because affordability was some of the pain points as stated earlier. As well as we help create more healthier Filipinos, not to take care of them when they are already sick. Yep.
Again, which brings us back to our first point about prevention, right? Now, Kurleigh, we have a lot of students here. They are the future of our country.
That's the last question, huh? I'm actually enjoying our discussion.
I know,
Okay.
right? But it's okay, because
Okay.
you're still joining us for the panel discussion
Okay,
later.
okay.
This isn't over.
Okay.
And you know, these are the easy questions. I'm sure later our students will have a lot more for you.
Okay, thank
But
you.
for now, what advice would you give to our students here today, or young professionals who want to help improve the country's healthcare ecosystem?
As I look around the room, I can see a lot of excited eyes, and keep that passion in you. You will be the face of a healthcare system that is actively transforming. I encourage everyone not to wait for your titles or your white coats or fancy office building just to start helping other people. Because at the end of the day, if we see a need, it's the right opportunity for us to help others. I've been a leader for quite some time now, and what I learned, which I want to share to everyone, is that you always lead with your head, but you also not forget your heart. And for every one of you, I would like to end with this message that your head will teach you the science of healing, but it is your heart that will teach you the soul of it. So
Perfect. Thank you very much. Because can I get a show of hands again from the audience? We had PT here, right? PT here. Anyone else in health? Did we have med tech earlier? Or
we need a lot of med techs.
Yes, we do. We do. So So I
And
want...
PT.
Oh, PT, yes.
Well, we will be opening another PT location at PNB Ayala.
Sige, lakasan mo yung applause mo. I can
We have
see you
one right
clapping
now
there.
at Centris. It's top of the line, so you can visit that.
Yes, because earlier I wanted to make sure that we have the students here who will really benefit from your talk, and also think about some questions later, because Mr. Kurleigh will be back for our panel discussion, and we'll be opening the floor so that you can ask him questions. And it can also relate to the earlier topics like nutrition or, health, anything. We have a lot of topics here that are intertwined. So right now, think about it. If you don't have it already, we'll welcome back Mr. Kurleigh later.
Thank you.
For now, let's give him a round of applause, please. Thank you very much for talking about all of that. And we'll look forward to hearing from you later during our panel discussion. Mr. Kurleigh Gacutan, everybody.